The Greatlakes region has endured over 2 decades of conflict and violence, leaving deep scars on the mental and psychological well-being of individuals and communities. Despite the significant psychological impact on people, the alarming mental health statistics highlight the urgency for comprehensive support. In light of this, the International Conference on Greatlakes, supported by GIZ, is conducting a 4-day training for stakeholders in Uganda on mental health knowledge deepening.
This is a rollout. We are here for rollout training on how to integrate mental health and psychosocial support in peace building and conflict response. Scenarios. We have invited all stakeholders that are engaged in this important subject matter: judiciary, office of the PD, office of the prosecutor, Ministry of Health, Ministry of Gender, civil society organizations. They are here for training, and this training is facilitated by the Regional Training Facility under the International Conference on the Greatlakes region.
As I said, when you talk about conflict, you even have conflict within your mind. You have conflict from outside. So issues of peace is not because there's lack of war. No. Peace is not because there's the absence of war. Peace starts with you. It's to do with your mental well-being. And that's why we're talking about the issues of psychosocial support, where, for example, a person is traumatized. Indeed, Uganda is not experiencing war, but there's also what they call the post-traumatic disorders that we have. And these are very, very important to deal with, because you may find somebody who may have become an orphan because of a conflict like we had in either ADF or in the northern Uganda. And therefore, this person, the way they may respond to certain situations may be different. So you need to understand the context of that person to be able to appreciate better why they may behave in a certain way.
The training seeks to equip stakeholders with knowledge and skills on prevention and mitigation of sexual and gender-based violence through mainstreaming mental health and offering psychosocial support in conflict response and peace building. Attendees targeted in this training come from Ministry of Gender, Ministry of Health, NGOs, Butabiko Hospital, among others.
You know that mental health is a problem, is a major challenge we are facing in our offices, in our households, and we know that the conflict in the region has led to traumatic situations amongst especially the females, amongst women, amongst the youth, and statistics present that 85% of those in conflict-related areas, conflict trauma, are faced with this challenge of mental disorder. So this training will help us roll out, help support and rebuild mental health amongst these displaced people. We know that we have peace agreements. Of course, we are doing a lot in the region. We have peace agreements. We have infrastructure development agendas. We have economic integration agendas. But all these have been ignoring the mental aspect that affect the physical and the psychosocial ability of people.
Many people are being reached out in the communities. Then it's going to prevent these mental health issues from escalating to a level of the referral hospital, from symptoms getting so severe, but rather the community can be able to identify these issues, understand what it is that they can do, and actually be managed when the symptoms are still mild, when the condition is still mild, so that it prevents it from escalating. At the same
Uganda hosts refugee communities, and people there have previously suffered from war and conflicts in their home countries, making Uganda a strategic partner in being equipped with tools and knowledge to provide therapy much needed by the refugees. Marion Awori and Crispus Arinitwe, UBC.